I'm pleased to be joined today on Health Beat by Dr. David Cockrum with Faith Regional Physician Services, Occupational Medicine. And we're talking about the occupational medicine physician. So how does an occupational medicine physician support a company's bottom line?
Right. So the employer's most valuable resource is their people, their employees, and that's the focus of the occupational medicine physician, is to ensure that those employees can support the company's mission or their desired product. The occupational medicine physician will partner with employers of all different sizes, from large industrial settings down to even small, very small settings, from industrial to office type settings. We'll develop an occupational health program that will maximize employee health and safety. It's a collaborative partnership with the employer, and when we need to, we will bring in other experts such as industrial hygienists, workplace safety experts, physical or occupational therapists, and others as appropriate to make the appropriate assessments. We'll determine potential threats to an employee's health, and these threats could be something that's in the air that they could breathe that could damage their lungs, or it could be something that they're touching, a chemical, and that could be in a large chemical plant down to even like a hair salon and the dyes they're using on their customers. Mm-hmm. We want to assess, is there a risk to the employee when using those things. It's also important to remember that common products that we use every day to produce those may use actually quite harmful substances to produce it. So we want to assess the use of those substances as they're producing the product. We'll also assess physical demands of the job. So if the job is very physical, there could be very risk of injury to the employee as they do the job, but even assessing things like ergonomics of someone sitting at a desk, how they're sitting, the placement of the computer and the keyboard is all things that we can work with. We'll then make recommendations to the employer on how they can reduce those risks, whether by reducing or eliminating exposures or providing protections to those employees. And the ultimate goal then is to protect the employee health and keep that employee on the job so they can do the work that the employer needs from them.
Well, it sounds like the tools are out there to really assure great outcomes for everybody.
Absolutely.
All right. Well, thank you so much, Doctor.
You bet.
Okay. And that's Health Beat, brought to you by Faith Regional Physician Services.